Hello and welcome to Port Huron Hospital's Today's Health Program. I'm your host, Michelle Fox. Most of us take the occasional knee discomfort in stride, but when the pain becomes more constant, we turn to our doctor for help. Joining me today to help us better understand the cause of knee pain and the available treatment options is Dr. Timothy Lucas, orthopedic surgeon on staff at Port Huron Hospital. Dr. Lucas, welcome back to the program.
Thanks for having me back.
Let's start with a review of the anatomy of the knee.
Okay, I brought a knee model, so I'll give you an overview. So the knee is basically a modified hinge joint. The end of the thigh bone, the top of the shin bone, that makes up the knee joint. The smooth surfaces in between, that's the cartilage, and in this model it's depicted as blue. In between the cartilage surfaces, there are the C-shaped structures called meniscus. That's the shock absorbers of the knee. You'll also have ligaments on the inside and outside that help stabilize, as well as the internal ligaments, the anterior and the posterior cruciate ligaments, that help stabilize the knee. On the outside, where you can't see in this model, are the supporting muscular structures that act as dynamic stabilizers for the knee.
What are the most common causes of knee pain?
In the acute setting, the most common causes are acute or sudden injuries, sprains of the ligaments, strains of the muscle, cartilage injuries, meniscal injuries. Those are like the weekend warrior or athlete type of injury, but anybody, normal people, can get injuries too. In the chronic or long-standing setting, pain can be caused from wear and tear. That's the most common cause. Osteoarthritis or degenerative joint disease of the knee. Osteoarthritis is a wear of the cartilage, as opposed to what most people think there's a buildup. There's actually a loss of cartilage, and that can cause pain in the long-term setting.
You mentioned sprains and strains. What are the most common ways to do that?
Sprains and strains most of the time come from twisting type of injuries, but they can come from contact injuries in sports like football or soccer, or non-contact injuries. But a simple slip and fall sometimes can cause an injury to those structures as well.
So what happens when you actually sprain or strain your knee?
Well, you can have a lot of different types of symptoms. Most of the time it's point tenderness in the area that you've sprained or strained. You can also get some associated swelling. If the ligament damage is severe enough, you can actually get instability. The knee can feel loose, it can feel unstable, it can give out, it can catch, it can lock.
Earlier you mentioned torn cartilage or meniscus. Can you tell us more about that?
Yeah, when you have a torn meniscus or cartilage, that can cause a lot of irritation inside of the knee. It can cause fluid buildup, so you can actually get stiffness when the knee fills up with fluid. You can also get mechanical type of symptoms, catching, locking, feeling like your knee is stuck and you have to maneuver it to get it to go again.
Tendinitis is another cause of knee pain. Can you tell us more about that?
Tendinitis tends to affect the attachments of the muscle on the bone, the tendons. You can have it in the front of the knee involving the quadricep tendon or the patellar tendon, or in the back of the knee involving the hamstring tendons, but usually localized tenderness. Sometimes that can lead to some stiffness too.
Now, how common is arthritis of the knee?
Well, if you're over 40, you've got it. Unfortunately. Again, arthritis is not a buildup of material, it's an actual loss of cartilage. So it's a wear and tear phenomena. I like to equate it to patients like a tire on a car. The tread wears out over time. The more miles you put on it and the rougher you ride your car, the more it's going to wear out.
Well, if we all have it over 40, that's a lot of people who have the arthritis.
It's very common.
What does it feel like?
Arthritis can give people soreness, stiffness, particularly in the morning when they first get up, soreness with weight-bearing type of activities, sometimes swelling off and on, but it tends to limit the amount of activities they're able to do, particularly weight-bearing activities. Sometimes people can also get night pain, night symptoms.
Dr. Lucas, this is great information. We need to take a break. We'll continue in a moment.